Hey everyone, welcome to the Couple Nurses podcast with your hosts Peter Findera and myself, Matt Slarchik. This is a podcast where we take out current health news and hot nursing topics, one conversation at a time. Thank you guys for listening. If you find any value in this podcast, please give us a review, a follow, and a share. As always, you know how much it means to us and what it does to our podcast and everything else. As always, vlogs are out, podcasts are out. The Couple News episodes are rolling. This episode number 38. We're recording from Houston. We're actually on a mini vacay, so we're doing our best trying to record. It's actually 2 a.m. right now, so it's about to be a nice late night show. And as you know, we have the Foundation Fight for the Forgotten. Our race is about 5 days out. I wish we were doing a lot more training. We're kind of out vlogging and doing a podcast out here. Food isn't helping the way we're eating, but we're doing what we're doing. I had some shin splints trying to practice running, I think 15 miles last week, so that was interesting.
It's okay. We'll get back to when we land in California. We'll be fine. We just have to run every day up until like Thursday.
Exactly, man. How you doing this night, I should say?
I'm doing good, man. I'm doing great. Still full from the food that we ate. Texas barbecue is on point. We went to 2 barbecue restaurants so far, and they're both fire. But in this episode, we're going to talk about the whole Governor Cuomo controversy, and we're going to also list a few other public figures that have lied to us or to Congress in the past, and we're going to also give you the usual COVID-19 update. So I'm not sure if you guys have heard, Governor Cuomo received an Emmy award for his press conferences, his updates with the whole COVID-19 in New York. I think he released like 111 different briefings or conferences regarding COVID-19 during the whole pandemic, and he got a reward from the Emmys because they viewed it as almost like a TV show.
It literally was. Every single day he had an episode.
Yep, every day was an episode, and they literally said that I'll read it from you. I'll read it word for word from CNN. Well, this is NPR actually. So I have 2 articles, CNN and then NPR. So word for word, NPR said that the governor's 111 daily briefings worked so well because he effectively created television shows with characters, plot lines, and stories of success and failure. So these briefings, these conferences that he was giving about COVID-19, they were so good it was almost like watching an actor perform. And as the truth comes out, it was a bunch of bullshit. It was said that he underreported their nursing home deaths by 50%. By not counting all the deaths that happened in the hospital. So he didn't count the deaths. If, let's say, somebody left nursing home and died in the hospital, he didn't count that as a nursing home death.
Damn.
So he underreported, made himself look better than all these other states.
And if you needed help, I mean, we had the ship there that the military provided, that Trump provided for a couple of days. That was not used. It wasn't being occupied. We had all these extra resources. I believe even in Millennium Park, right there at the camps, whatever, set up. So it's crazy how he did not get any help, yet he was this hero during the whole COVID pandemic as a governor in New York.
He literally lied. He literally covered up numbers, and now there's supposed to be an FBI investigation on why he did it, how did he do it, was it on purpose, was it an accident? And I mean, clearly there's no accident, I would say. He's the governor, he gets all of the correct numbers, he's got a whole team working on it. It's just something that they knew about and they just refused to report. Or they just reported it just to kind of make themselves look better than they actually are, which ended up happening because this dude literally got a reward because people thought he was doing so good compared to like California and other Democratic states. And so, he was just talking out of his ass.
Yeah, and then this is also the guy that, there was a pandemic in Italy. So they're comparing it constantly and what we're doing different and everything else. So, man, I don't have much to comment about it. Like, I'm just upset about, like, everything that's happening. Like, this whole episode that we're going to talk about the public figures that's lying. I feel like there's constant lying to be done. Even about COVID itself, just to kind of bounce off Cuomo. Like, from January 8th, right, there was 260K cases, new cases, as a 7-day average. By February 22nd, that 7-day average dropped to 76,000. So if you do the math, that means, and this data is available on Google if you type in the 7-day average. It's not hidden, it's in plain sight. There was a 74.3% reduction in coronavirus cases this past month, from February to January.
Out of nowhere.
How come no one is covering the freaking great news? We should be rejoicing that, hey, we finally, 74%, it seems like we kind of fought the curve here a little bit, got flattened.
I feel like they're not talking about it because people are going to start asking questions, and they're going to be asking the wrong questions. Like, why is it should dip in numbers? It's because they're probably underreporting it and they're not doing as much testing. And obviously, you know, I don't want to bring it to politics, but there's been a change in administration, and you know, of course, they want to bump up the new president, saying he's doing a good job. We're finally getting over the hump. So they're gonna probably underreport, just make themselves look a little bit better.
Pete, how many episodes did we do where we talked about this? Hey, election's gonna come. The numbers probably gonna look better. Things are gonna kind of be changing. We didn't predict it. We don't have a black crystal ball. We just kind of are aware of what's happening and how things play out, and it seems like it's exactly going according to plan, right? And now the question is, and the people are asking, is like, what's going to happen? When are we going to reopen? When are we going to decrease measures, right?
Well, slowly we are, because we just read online, Utah is getting rid of the mask mandate. There's states out there that are saying that masks aren't necessary anymore. And some states are even saying that, hey, we finally reached a threshold of starting to do schools now and starting to do sports and other activities.
Yeah, so North Dakota was that first state that made public masks technically illegal, where they took, it's going to be illegal in the future if they mandate them on a federal level, but they removed them from the public to wear them, meaning it's not necessary, not mandatory.
So slowly we're moving in the right direction. Do we think this is going to happen, you know, quickly? Probably not. It's probably going to take a little bit, and I wonder where this new normal is going to be, you know, or what the new normal is going to be. We could for sure say that new normal is going to be more remote learning, more remote jobs, more work from home, and like beyond that, I'm not really sure. Do I think masks are going to be mandatory? I don't think so. I think it's going to be a choice for us to wear masks now because it's more common, and we're going to see a lot of people shift from no mask to mask. There's still going to be that kind of divide, you could say, between maskers and non-maskers, if you want to say that. But I don't think there's going to be like a requirement for masks anymore. It's going to be your choice.
No, I hope so, because look at the whole vaccine situation, correct? Which is still kind of tricky. We're trying to get kids back in school, right? So I know the CDC is trying to release guidelines. What is the most effective way? And I actually found some 5 universal ways that they're going to implement strategies for essentially delivering safe in-person education. So I could go over that in a little bit. But yeah, so my question is if masks won't be mandatory, will vaccines be? Because there's already such an oppression towards them that the government is implementing, whether it's with flight, travel. What if in 2022 we're going to do that for festivals and things like that? What in Israel, I feel like it's already kind of happening, where they're saying it's so important and society is getting so well, you know, adjusted to the vaccines that they're going to create oppression for the non I don't want to call them anti-vaxxers, but the people that just simply decide that, hey, I'm healthy, I don't need this vaccine.
I mean, I hope there is just a giant switch. I hope it doesn't turn into one of these things where there's going to be some kind of a proof of vaccination that you have to carry around, or a proof of vaccination to enter an airport or fly.
Yeah.
That would suck, because like we said it before, that does not become a choice anymore. If you're saying, hey, you could either choose to get vaccinated or not vaccinated, but if you don't get vaccinated, we're going to see these restrictions on you, that's not your choice anymore, because you're already setting restrictions.
So this is what's crazy to me, and correct me if I'm wrong, but is it insane? Because what's wrong with the government that's telling perfectly healthy people to inject themselves with a foreign substance in order to win back their basic freedoms? That sounds extremely dangerous to me for my own civil liberties. So, like, you know, who's a crazy one here?
Yeah.
Where I'm a completely healthy person, all of a sudden this happened. Now I have to win back my ability to go to concerts, which was before just a personal choice. Now it's going to be a decision whether or not I have this vaccine card or whatever digital proof I need to present in the future. Yeah. That sounds crazy to me.
That's wow. That would definitely suck. But have you noticed that there wasn't any talk about the flu or flu shots
at all?
Like, you know, isn't it flu shot season? Shouldn't we have had our flu shots already?
From October to March every year.
Yeah, no one's talking about the flu shots. You know, everyone's talking about this COVID vaccine. What happened to the flu?
Yeah, especially every single year in nursing.
Mandatory flu shots.
You need mandatory flu shots.
That's gone now. For some reason, no one's talking about it. Are we gonna like bring it up like maybe at the end of March now or beginning of March? I don't think we're gonna bring it up at all. It's already 1 month away from March.
Yeah, it's already past the development of a new strain.
Flu season, there was no flu season. It's just COVID-19 season, year round.
Yeah.
Yeah. So I feel like possibly they're going to have it be like a flu shot, where slowly they're going to say, hey, healthcare workers should receive this COVID-19 vaccine because it's going to protect, what they work with, things like that. But I'm not sure how common flu spread is in a hospital or how it was prior to the mandatory vaccines. That'd be cool thing to look at.
Yeah.
Like they were relating the flu shots for healthcare employees was flu being spread around that easily and that quickly and to that point, that amount that we needed a vaccine for it. Because we never looked at that, have we?
No, we
that
have
always
not.
good to look into.
Yeah, and also like Dr. Fauci a couple of days ago, he went on CNN and he was talking about they're going to finally release some CDC recommendations for how people should be interacting for fully vaccinated people. And this is what kind of bothers me is that they're creating this, remember, illusional oppression that they're going to release guidelines for only vaccinated people. And this is what's weird is they always use this lingo to discourage and to manipulate things. So now...
Or it's always like this side or that side. It's either with us or against us.
Yeah, and now if you're vaccinated, you don't need to quarantine and all this. But if you think about it, the vaccine doesn't protect you from the virus. You still have a chance of getting it. You might just not be presenting as many symptomatic, symptoms.
Yeah. Well, this kind of makes sense because then like your viral load will be lessened, right? If you don't have the symptoms, the
Yes.
viral load is lessened, so technically less opportunity for you to spread it. But if you're gonna start doing like these guidelines, like you have guidelines for people that don't get vaccinated, guidelines for people that have vaccinated. You're kind of spreading us.
Imagine if you're gonna segregate those people.
Yeah. What is it gonna be like vaccine pro like restaurants? Like they're gonna be like you can eat here if you got the vaccine.
Yeah.
Like imagine if I don't think it's gonna go to that level. I don't think America is that crazy about this. But you never know. You still don't ever know. Do I think it's gonna be like that? No, I think slowly it's going to, I guess, no pun intended, die over.
I mean,
slowly things will be back to normal.
Between me and you, man, I mean, it's 2 a.m. right now, and like, I'm very confused on where things are going, man. Like, the CDC has switched guidelines around like 16 different times. I'm, of course, blowing up the number.
Yeah.
This past year, like I don't know what else is going to like be implemented. Like, what are they going to do with like, for example, like kids going back to school? Like, are we gonna just like put them in these like bubbles? They're gonna have to be like socially distancing. Like, technically, social distancing is an 80-year-old term. It's actually an 80-year-old science that like started in the 1940s when they finally discovered like they basically took. Scientists finally got a first glimpse of what happens when people sneeze, and they had like a frame of like 30,000 frames per second, and they were able to see real time how far this sneeze spreads, and they're able to calculate it that it's between 3 to 6 feet, and that's been the science since 1940 about this, theory of social distancing. We just never challenged this science.
I mean, I think it makes sense, like just on like a physical perspective. The closer you are to somebody, the more of that splash you're getting. And the more splash you're getting, the more, particles you're going to have, right? Because if I sneeze your face right now, compared to if I'm 6 feet apart, then you're obviously going to get hit harder with the closer sneeze than a further sneeze,
Yeah, but so this article that I read, it was kind of disproving germ theory. So that's why they're disproving this whole argument about all this. And that's a podcast that we could totally talk, have a whole episode about germ theory.
I don't think germ theory is fake. Just because I can't see germs, I can't examine them, doesn't mean they don't exist.
Well, that's not necessarily saying that germs are fake.
What is germ theory?
I'm not gonna completely describe the whole definition. I could go into it, but
we haven't really looked into it. But yeah, maybe we should just go to germ theory on one of these episodes, just see what's going on. Like, a lot of people think that it's a conspiracy that's fake. But I've never really looked too deep into germ theory about what it actually is. I'm not and just by the way it sounds, I think people that don't believe in germ theory are people that don't believe that small molecules exist or small viruses exist and you get sick from them. Is that what it basically is saying?
It's an unknown evolution of the germ theory hoax. So it's saying that it's pseudoscientific belief that germs do not cause infectious disease. That's what the disproving of the germ theory is.
So it's saying that germs don't cause disease?
That's what the hoax against the germ theory saying. So it's technically a conspiracy because you can't prove. You actually can't prove either or, because I don't want to go down this rabbit hole, man. But in 1884, Lewis, what's his name?
Clark?
No, Louis Pasteur is the guy that created the model for infectious disease, correct? So now they're saying that, and this is where the germ theory started. So now they're saying they might be denying it, where it's been disproven.
But do I believe in that there's viruses that purposely infect us? No, I just feel that viruses don't I feel viruses don't care who you are. Like they're just them doing their thing. They don't have a conscious effort of infecting. It's just what they cause. We should probably look into germ theory. I'm pretty curious because I feel that's trending a lot now. And anti-vaxxers were trending a lot in the beginning, or I feel like anti-vaccine trends every so often you hear about it, but recently it definitely popped when the COVID vaccine actually first came out. There's a lot of people that in the anti-vax community that were opposing it and things like that. So that kind of popped. But now definitely germ theory, flat earth theory is popping too. But I mean, I don't think you have to go too in depth in a flat earth theory, right? Because that's a bunch of foo-foo.
Yeah.
Germ theory would be interesting to explore just to kind of get a better perspective of their opinion. Do I believe in germ theory? Yeah, I'm not one of those people, but maybe I'll change my mind after we look into it.
Yeah, so there's these 5 keys that they're mitigating these strategies for the COVID-19 transmission in schools. So one of them is the universal and corrective use of masks. So of course they want to implement masks, they want to implement physical distancing, they want to implement hand washing and respiratory etiquette. So of course, cover your face when you sneeze. In this case, you'd have a mask, or just look away, wash your hands, cleaning and maintaining health facilities, and they're going to do contact tracing with a combination of isolation and quarantine. So I don't know how they're actually going to collaborate all that. How are they going to do that with students? But those are the 5, strategies they want to implement for reopening schools K through 12.
Yeah, we'll see. I mean, the president himself said that children are not likely to get the COVID vaccine, and by going to school, they shouldn't be afraid of catching it or affecting their parents with it and their grandparents. The president literally said it himself to a young girl on stage in public.
Even if you look at the cases and everything and the deaths, they're very, very low.
And that's how I feel like things like an infection like that, because the first people to die are always going to be the more susceptible ones, right? It's not a disease that affects healthy people. It affects people that have a lot of comorbidities, a lot of already issues going on with them that are unhealthy, right? So slowly over time, this disease should fade away, because as we've seen before, it doesn't kill a lot of people that are healthy individuals, right? So logically speaking, yeah, it'll trend up because more people catch it, more people die. But hopefully, ideally, as society moves to a healthier pace, and the people that are most susceptible pass away and die, it's going to slow down the trend. Because the virus is going to affect other people, but it's not going to be as deadly, because I guess you could say the healthier people have survived.
Yeah, that's why, going back to the deaths, that's why Cuomo basically committed a crime, man. Because he basically led the death to the elderly population, which is the most vulnerable population.
Yeah. So that's how it is. But as we're back to Cuomo, I actually looked up a few other people that have lied to Congress, so essentially have lied to us. So just because they hold a position of power or a fancy title doesn't mean that they're not going to serve the best interest, right? Look at Cuomo. He literally lied about his numbers, made himself the talk of COVID-19, basically, with all his press conferences. He got a damn award for it, and it comes out, hey, he's been lying this whole time.
Yeah.
That's a bunch of bullshit, and I'm not saying, the Republicans don't lie. Trump lied a bunch of times. These people lie just to kind of get their best interest and get their way, because that's what they're kind of in office for, right? They do politics. So that's their job. If Cuomo leaves his government job, what is he going to do? He's a politician. What is he going to do?
Even his brother, he's in the news. So they maintain these high roles, and
they do, man.
They're great actors, just like you said.
So just to name a few, if you guys remember, well, probably not, but it depends what age you are, I guess. I could say, if you guys remember Watergate with Nixon, so that was literally Nixon lying to Congress about his involvement with Watergate, which ultimately led to him resigning. If you guys don't know what Watergate is the Nixon campaign supposedly hired some people to spy on the Democrats. They broke into their office, stole a bunch of paperwork, emails, and all that stuff. And it turns out that, hey, these people that robbed the Democratic convention were actually hired by the Nixon campaign.
Damn,
which ultimately led to Nixon's resignation and the whole Watergate scandal.
And I mean, Obama did the same thing when there was a transition of power to Trump.
Yeah.
But it was considered illegal because we've passed all these law that allows us to freaking, surveillance your phones now.
Yeah, dude, it's crazy. It's done all the time. Another interesting one that I found, you guys probably haven't heard of him because I haven't heard of it myself until I researched it, is Harvey Matzo. And this guy was an ex-communist who had become an FBI agent, and he lied about 200 people being communists or being communist sympathizers. So basically, he led 200 people to be jailed or fined unethically, and it was just a giant lie, and he lied to Congress about it. He wrote a book about it. That's crazy. That's kind of what's happening here. Like, there's a point in time where me and Matt thought that neighbors are going to snitch at neighbors for not wearing masks. Right? It got to that point where there was lockdown, and especially in California with these weird ass laws and stuff, people telling on each other. It was so weird. It was like almost like in the communism days.
Yeah.
We haven't lived through the Cold War because we're not as old, but just because we're not living through the Cold War, haven't experienced it, doesn't mean we can't think of this being like the Cold War ways, right?
Correct.
So it's interesting to kind of look back at that because it's pretty scary, man.
Yeah, the only way I get ideas of how communism is just talking to my grandparents and seeing how Poland behaved, and how they had to stand in line just like we did, and everything was on notes on paper where you turn things in, you get a pound of meat, and everything was scarce. And that's one thing where what communism does, it makes you kind of turn against your neighbor, and everything is to the state in a way.
Yeah, you don't own anything. And the third one I looked into, this was pretty interesting. His name was Casper Weinberger, and he was the former defense secretary, and he actually got indicted on felony charges in 1992 because he lied to Congress about his role in the Iran-Contra scandal during the Reagan administration, where they basically sold arms to the Iranian government to support a militant rebellion in Nicaragua. So basically, they sold arms to a rebel group so they could stir some shit up and then kind of push law their way, so then the U.S. could, form a little stronghold in Nicaragua.
Wow.
Because then, so with some of these rebellions, a lot of these countries fund these smaller country rebellions, and then they put a political figure in power that supports their laws, their ideology and things like that, and then they kind of collaborate, and that's how countries grow in power without actually taking over the territory.
And that's what blows my mind is that this happens all the time in different states, and we're just so blind to the way propaganda works. It happens in so many different countries, and I think America was involved in the whole Operation Fast and Furious, where we're selling weapons to the cartels and stuff like that.
Yeah,
but that's just that story gets hidden very quick.
Yeah, there was this was Joe Rogan, and he was talking about, I don't know who he had interviewed, but they were talking about a bunch of military people that got caught shipping guns across Mexican border.
Wow.
So what they would do is, because when you cross Mexican border from U.S. to Mexico, you don't get searched really. You just cross, and it's not as big of a process as it is coming from Mexico to the U.S. So they would just take a bunch of guns, and they would drive to Mexico, and then they would sell them, and they would come back with cash, or he would tell a story where they would come back with drugs and cash.
Yeah, this is the U.S. military.
This is the people in the U.S. military. They would bring them guns, and they will repay them with cash and drugs.
Wow.
And they will bring that back over. And that's crazy, dude. That goes on because it happens. It's human nature. People see opportunity, and it's not necessarily a choice that me and you to make, but people love money and they love power. Imagine how big of a rush they get selling guns to Mexico, dude. That's wild, man. That's all you gotta do is take some guns, drive it across Mexico, and you're making millions of dollars, hundreds and hundreds of thousands of dollars, and you bring that back.
Yeah, and it's what is the military doing now, where things are a little bit quieter? I know things are getting stirred up, but I feel like everything's kind of turning away from foreign affairs, and everything's going very domestic. On the news right now, everything is towards white extremism, racism. We need to protect the people of our country from all these right-wing extremists. That's all that you're hearing. It's we're going into this I mean, we're not going to go into a civil war, I hope now, but it's just like the American people are just going against each other, man, more and more. It's. I always say it's weird times. Like it is what it is. It's just like part of, I don't want to say human nature, but I feel like the system just creates us to hate each other, to be angry and just be fearful constantly, man.
Yeah.
Just like we talked about that drop in COVID cases, right? 74%, man. Like, not even a hurrah, not even. That's when I see things like this. That's like that what like brings me over the edge. That I'm like, man, like some of this shit's just bullshit.
Well, then flip it around. How would you feel if it was all over the news? That's all they're talking about. Like, just dropping COVID. We'd be saying like, we'd be talking shit too.
Why don't you give the human population some?
No, I'm saying we would be talking
happiness.
Shit. I mean, they could be happy, but I'm not taking away happiness. I'm just saying the perspective that we take sometimes, because you're all a little biased sometimes. You know what I'm saying?
I mean, this episode's very biased.
I mean, I think it's very biased.
We're just chatting. We're just chatting out of our ass.
Yeah, but I think it's very biased. Like, because I think about it, I feel like if they did have this all over the news, like 70% drop in C19, things like that, we'd probably be talking a little bit of shit too. Like, where does drop come from? How does this drop happen? Which is good too, because we kind of look at the point that they bring up.
Yeah.
Right. So we kind of try to figure out. We're not necessarily always against the media, but we try to figure out their perspective and why they're pushing this perspective.
Yeah.
So we always kind of tackle. We're always kind of like the devil in the room, like trying to flip their opinion, because we just like to see everything from all angles.
Of course.
I feel like.
Yeah. So, but back to my thing, I'm just saying, like, yeah, if there's like 70%, right? Why can't we celebrate anything? Like nothing that has been going on this past year. Like we're celebrating something positive.
Why can't we leave the restrictions, right?
Yeah, it's like, dude, okay, there is. I looked this up. There's 19.44 million people in the United States right now that are fully vaccinated. That's great. So, the U.S. population is 320 million. I mean, that number is still small to where we have to get. I think, what is the estimates for herd immunity? Somewhere from 55 to 72%.
Yeah.
So, I think that'd be good. It'd be a good way if we had like some kind of marker towards like, hey, this is our goal.
But who said that number? 55 or 72%? Like, who said the number? What if it's like not a really strong disease or not a strong infection where we don't really need that much? Who says these numbers?
So, and that's the thing. These scientists exactly don't know what percentage herd immunity needs to be established, because remember how there's a different percentage for like measles compared to I don't know what I want to compare it to, but every single disease and or virus has a different threshold.
Mm-hmm. Yeah.
We were comparing a couple episodes ago.
Yeah. So the thing is, like, so the 55.
It's a made up number technically.
Yeah. Well, yeah, but the 55, 72%, is that how much people we need vaccinated, or how much people we need immune? Because there's like 20 million people that are vaccinated. Imagine how many people are already immune to it. We might be already at 50%. If we're spiking down that hard, and these are actual numbers and still reported the same way as they were before, then I would think we're over there, right? If we have a 70% drop in cases.
Yeah.
Right? You come to the same conclusion, like, we have this big ass drop. I'm pretty sure we're already in that threshold. So they probably got to push vaccines to either one, kind of make it like a double check.
Well, it's a business at this point too, right?
Or they want to make some money. Those are two reasons. Either like, they want to be extra careful, or they want to make some more money.
Right. If you're part of the vaccine manufacturer, you're not going to push natural herd immunity, because that's just going to decrease your dollars, less vials, less money in your pocket, right?
You know what they're going to say? They're going to say we don't count natural immunity because we don't know how to evaluate it.
Yeah. We can't put a price tag on it.
Right. Like, we don't know how to evaluate if you have natural immunity, and there's too much for you to evaluate, so we're just going to push for you guys to get this vaccine because that's easier to count and you get your money. You know what I'm saying? Because it's a shot and a check mark next to your name and $1 in our pocket,
Exactly.
It's easier.
And that's why I am the unvaccinated control group.
Mm-hmm.
So I'm just trying to do my part here, being the control group.
That's what I'm saying, yeah.
And we'll see what happens. And I'm glad that I have the ability to stand up against what other people think, and we challenge these views. Yeah. We do it live on a podcast. I'll do it live when I interact with people, and I feel like people respect my opinion for it. Yeah. At least on a external level. They might not like it, but it is what it is. Yeah. I just hope that we just like I always say, man, hopefully get to some kind of norm. And what is that norm, though? That's the thing, man. When you look at these big governments, the whole George Orwell 1984 thing has been pushed around a lot, too. It's like, how much more of our freedom are we going to get back now? That's the question that we always ask ourselves from, 9/11 to where we are at now.
Only time will tell.
And there's another war coming, what Bill Gates said, right? There's a war with climate control right now. That's
always a war. There's always a war for something.
That's like the next transition. Like there's just like you say, there's always war. If it was in Iraq, it was Al Qaeda for years. Now there's a war with the virus. Now there's gonna be a war for climate change. It's like we're always trying to, battle something.
Right. Always. That's a wrap, I think.
You can wrap it up.
Yeah. Thank you guys for listening. Don't forget to check out our Patreon. That Loud. Hit the subscription. I really appreciate it. We have some cool content out there for you guys. And also, don't forget to donate for the Fight for the Forgotten. Us Foundation, we're doing the 4x4 48. Buy yourself a David Goggins t-shirt. Buy yourself a Fight for the Forgotten t-shirt. More importantly, donate. If you want to donate through us, if you don't want to donate through us because you don't like us for some reason, then you can just donate on the website. That easy. Donate something. Peace out.
Peace, guys.